Hello everyone, this is Dr. Sam, and today we will learn about knee osteoarthritis on an X-ray. Knee osteoarthritis is a common joint condition that happens when the protective cartilage in the knee gradually wears down over time. This cartilage normally acts like a cushion between the bones, allowing the knee to move smoothly. When it breaks down, the bones begin to rub against each other, causing pain, stiffness, swelling, and difficulty moving the joint. People with knee osteoarthritis may notice symptoms such as pain while walking, climbing stairs, or after sitting for long periods. It is more common with aging, previous knee injuries, excess body weight, or repetitive stress on the joint. Although it cannot be completely reversed, treatments like exercise, weight management, physical therapy, medications, and sometimes surgery can help reduce pain and improve knee function. We will compare the X-ray images of knee osteoarthritis with normal knee images for a better understanding. This is an anteroposterior AP view of the knee joint. In this view, we assess the distal femur, proximal tibia, fibula, and the joint spaces between them. Starting from the upper part of the image, we can see the distal femur, which forms the upper portion of the knee joint. On the femur, there are two rounded bony prominences called condyles. On the inner side, we see the medial femoral condyle, which articulates with the medial part of the tibia. On the outer side, we see the lateral femoral condyle, which articulates with the lateral tibial condyle. Between the femur and tibia, we observe the joint spaces. These represent the area occupied by the articular cartilage and menisci. On the inner side, this is the medial joint space. On the outer side, this is the lateral joint space. In a normal X-ray, both joint spaces should appear symmetrical and well maintained. Moving to the lower part of the joint, we see the proximal tibia, which forms the lower part of the knee joint. The tibia also has two condyles. On the inner side, this is the medial tibial condyle, which articulates with the medial femoral condyle. On the outer side, this is the lateral tibial condyle, which articulates with the lateral femoral condyle. On the lateral side of the leg, we can see the fibula, which is the smaller bone running parallel to the tibia. Although it does not directly form the knee joint surface, its head is visible on the lateral side below the lateral tibial condyle. So overall, in a normal knee AP X-ray, we assess the distal femur, medial and lateral femoral condyles, medial and lateral joint spaces, proximal tibia with its condyles, and the fibula. The medial and lateral femoral condyles appear symmetrical and articulate smoothly with the corresponding tibial plateaus. The joint spaces on both medial and lateral sides should be relatively equal, indicating preserved articular cartilage. The intercondylar eminence of the tibia is visible centrally, and the fibular head is seen partially overlapping the lateral tibial condyle. Cortical margins of the bones should be smooth and intact without any fractures, erosions, or deformities. On the right is an image showing osteoarthritis. Its main feature is joint space narrowing. Joint space narrowing is the most important radiographic sign of knee osteoarthritis on X-ray. It occurs because the articular cartilage that normally covers the ends of the bones gradually wears away. And since cartilage itself is not visible on X-ray, its loss appears as a reduction in the space between the femur and the tibia. This narrowing is usually asymmetrical, most commonly affecting the medial compartment of the knee more than the lateral compartment. As the medial joint space progressively decreases, the mechanical axis of the knee shifts, which can eventually lead to a varus deformity, commonly known as bow leg deformity, seen in patients with medial compartment osteoarthritis. Osteophytes, also known as bone spurs, are bony outgrowths that develop along the margins of a joint. In the knee, they are most commonly seen at the edges of the tibial plateau, the femoral condyles, and around the patellar margins. These bony projections form as a response to joint degeneration, particularly when the cartilage that normally cushions the joint begins to wear down. As the joint becomes unstable and experiences increased mechanical stress, the body attempts to stabilize and repair the area by producing new bone along the joint edges. Over time, this compensatory bone formation results in osteophytes, which are a characteristic radiographic feature of osteoarthritis. Let's look at more cases of osteoarthritis. In this image, we can see a reduced joint space. The lateral joint space is narrowed, so there is loss of articular cartilage here. This indicates osteoarthritis. This is a severe case of osteoarthritis. The medial joint space is severely narrowed. Bone spurs are also noted. Another feature to note is subchondral sclerosis. Subchondral sclerosis is a radiographic finding seen in conditions like osteoarthritis. It refers to an increase in bone density in the subchondral bone, which is the layer of bone located just beneath the articular cartilage of a joint. On an X-ray, this change appears as a whiter and thicker area of bone compared to the surrounding normal bone. It occurs because repeated mechanical stress and increased load on the joint stimulate the bone to become denser and harder as a compensatory response to cartilage degeneration. Here is another case of osteoarthritis. You can see medial joint space narrowing, with osteophytes present. There is a significant reduction in the medial joint space. Bone deformity or remodeling is a radiographic change commonly seen in advanced osteoarthritis. It occurs when chronic joint degeneration and abnormal mechanical stress gradually alter the shape of the bones forming the joint. On an X-ray, this may appear as flattening of the femoral condyles, where the normally rounded ends of the femur become more flattened due to long-term pressure and cartilage loss. The joint surfaces may also look irregular or uneven, reflecting damage and remodeling of the bone beneath the cartilage. Over time, these structural changes can lead to alignment deformities, such as varus deformity, also called bow-legged alignment, or valgus deformity or knock-knee alignment, depending on which compartment of the knee is more affected. The femur and the tibia are not in proper alignment. The knee is slightly rotated, which makes the fibula overlap with the tibia. Joint space narrowing is observed, and subchondral sclerosis is also noted. Subchondral cysts, also known as geodes, are a radiographic feature often seen in advanced osteoarthritis. They appear on an X-ray as round, well-defined radiolucent, dark areas located beneath the articular surface of the bone. These cystic spaces develop when synovial fluid from the joint is forced into the subchondral bone through small defects in the cartilage, or they may form due to localized bone necrosis caused by chronic mechanical stress and reduced blood supply. As osteoarthritis progresses and cartilage degeneration worsens, these subchondral cysts become more noticeable and are commonly associated with other findings such as joint space narrowing, osteophytes, and subchondral sclerosis. Lateral views are also helpful in the diagnosis of osteoarthritis. we can see the joint space narrowing. You can compare the narrowing with the normal joint space appearance in the lateral view. Bone spurs are also present, and there is increased radiodensity of the bone just below the articular cartilage, indicating subchondral sclerosis. The skyline view, also called the sunrise or merchant view, is performed in a knee X-ray to specifically evaluate the patellofemoral joint, which is the joint between the patella and the femur. In this view, the X-ray beam looks down onto the patella while the knee is flexed, allowing clear visualization of how the patella sits within the trochlear groove of the femur. This helps detect patellofemoral osteoarthritis, joint space narrowing, patellar subluxation or maltracking, and osteophytes that may not be visible on standard AP or lateral views. Therefore, the skyline view provides a more detailed assessment of the patellofemoral compartment of the knee. The lateral condyle of the femur will be larger than the medial condyle in this view. This is how we can tell which side is medial and which side is lateral. The patellofemoral joint space is narrowed in some cases of osteoarthritis. It is often called patellofemoral osteoarthritis. Thank you so much for watching. Stay tuned for more imaging videos.